I'm Dr. Annie Savage. I'm a naturopathic doctor. By the end of today's video, you'll understand how the oral birth control pill works, what it's doing to your body, and you'll be able to make an informed decision whether it's the right choice for you. Please like and subscribe our video, subscribe to our channel, and click the bell notification to get notified every time we have a new video out. Let's jump right in. Birth control pills are made from synthetic hormones. Typically, they're made of a combination of estrogen and progesterone. Progesterone is called progestin when it's a synthetic hormone. Some of the oral birth control pills will have both in differing volumes throughout the month, and then other pills will have just one type of hormone, the progestin pill only or the mini pill. And some of those pills will have the same amount of hormone entering your body throughout the entire month. So if your pill pack has different colors of pills in it, you probably have the kind of pill that is changing your hormones throughout the month. So it's meant to mimic your natural hormones, whereas the progestin pill or the mini pill only has progestin in it, and that one is safe for breastfeeding mothers. So they're the ones who are most commonly taking it. Other women sometimes cannot take estrogen at all, and they will also be put on the progestin only pill. The way the oral birth control pill is made is through horse urine. So what they do is that they actually impregnate mares or female horses so that we can collect their urine and extract the estrogen from there. A lot of women, when they learn that, are really not comfortable with that. So that's enough information for them to say, no, they don't want the pill. Other women are okay with that, but that is how our oral birth control pills are made and synthetic hormones are made. First, let's talk about the mini pill. So this is the pill that has progestin only or progesterone only in that pill. Most women who take this will be breastfeeding, so they aren't getting estrogen, so it's not being fed to their baby through their breast milk, or they're women who just can't handle synthetic estrogens. This pill thickens the cervical mucus so that sperm can't get through. It can't swim up the cervix as easily. And it has to be taken at the exact same time every single day. So it's a very finicky pill, and it's about 95% effective. Most women who take the pill are taking the pill for 21 days out of the month, and then they are taking nothing or a sugar pill for the 1 week of the month when they are meant to be menstruating. Some women have figured out that if they take their pill every single day of the month, they will not have a period at all. So they'll do that for holidays to kind of skip their period, move it around to when they want it, or their physician has actually told them to do that for some symptoms. This is not very natural, obviously, because you are not bleeding at all. And as women, we are meant to bleed. Our hormones are on a cycle so that we do bleed every month. So there is some more risk to doing that, but it is considered safe in our medical community. The pill is very effective as a contraceptive when it's used properly. So most of the pills are meant to be taken around the same time, except that mini pill. It's very important that it's actually taken at the exact same time every day. Most you have a little bit more leeway, but within a couple hours, you need to take that pill at the same time every single day for it to be completely effective. You should also note that it is not protecting you against any sexually transmitted infections or diseases. So you do want to use something else for that. Some side effects that we see with the pill are bleeding irregularities, so spotting, which would be bleeding within the middle of the month or before your period, mood swings, weight gain, breast tenderness, headache, and low libido. These side effects begin because we have too much or too little hormone for that woman. So it's either too high for your body or too low, and it creates these side effects. It's also a synthetic hormone, so it's different than the hormones that our body is actually making, which can help add to these side effects as well. All oral birth control pills actually lead to less libido or a lesser sexual desire. That is because it increases our hormone, sex hormone binding globulin, which in turn causes less testosterone to be made. So that's where that low libido picture comes in. On the flip side of that, that is actually why it's helping to treat acne. So some women with a lot of acne will have higher testosterone profiles, and taking oral birth control lowers your testosterone. So it will heal up your acne, but it goes hand in hand with having that lower libido. So let's talk about how the pill actually works. The estrogen component of the pill is inhibiting the release of FSH, which is your follicle stimulating hormone from the brain. And when it's inhibiting that release, we don't have a follicle that's chosen as the dominant follicle. So what ends up happening is no egg is ovulated. So your body thinks you're pregnant all month long, and no egg will ever be ovulated because the FSH is not picking that dominant follicle to be released. Like I mentioned earlier, the progesterone or progestin component of the pill is thickening the cervical mucus to make it harder for the sperm to swim through and actually reach the egg that we now know is not actually there. It's also affecting the uterine lining. So it's an inhospitable environment. So the fetus or implantation shouldn't be able to happen when you're taking the pill. The estrogen-specific side effects that the pill might give you is bloating, headache, breast tenderness, increased vaginal discharge, higher high blood pressure, and melasma, which is a rash across the face. The progesterone-related side effects specifically are more mood-related. So we can see fatigue, depression, bloating, cyclical breast pain, and weight gain can all be problems with the progesterone component or with that progestin mini pill. With the estrogen component of the pill, we do see increased risk of thromboembolisms, which are blood clots. We see risk of stroke and heart attacks are all increased. These are also worsened by confounding factors such as obesity, smoking, and family risk. So we do need to look out for those. That's why your doctor is probably and hopefully asking you about migraine headaches and checking your blood pressure before they prescribe the pill to you. We also see the risk of more incidence of breast cancer as well as cervical cancer in women who are taking the birth control pill. The breast cancer risk is interesting because you have a higher risk of breast cancer while you're taking the pill, but after 10 years of being off the pill, your risk returns back to normal. Depending on the length of time that you take the oral birth control pill, you might have a harder time beginning to ovulate when you go off the pill, and therefore more of a difficult time trying to get pregnant. Statistically, this doesn't seem significant. I've looked up a whole bunch of studies that all kind of say the same thing, that there is no change. Clinically, we do see a difference. So sometimes it's just harder to restart that ovulation. When we're giving the body exogenous hormones or synthetic hormones, our body will actually make far less of our own hormones and stop making our hormones altogether because it's given those hormones from outside. So when we take those hormones away, our body then has to pick up the slack again. And sometimes that can take quite a bit of time, depending on how healthy you were before you went on the pill and how unbalanced your hormones were then, and then how unbalanced they are when you come off. So if you watched our other video about how to come off the pill, we give you some tips and tricks to support yourself if you're on the birth control pill, so you do have an easier time beginning to ovulate when you go off the pill again. Let us know in the comments below if you've ever taken the pill, for how long, and what your experience was with it. Some women have no issues whatsoever. They take the birth control pill, they go off, they get pregnant, not a problem. Other women will be put on the pill and all the side effects happen. So they may try to switch to different kinds, different brands, different dosages, and sometimes that works. But for some women, synthetic hormones just don't agree with their body and they can't be on the pill. Other options for contraceptive obviously do exist. Less hormones would be ideal. So the IUD, there's implants, there's shots. We also see now that a lot of women are put on the birth control pill, not as a contraceptive device, but as a treatment for something else. So many women are given the pill for acne, like I mentioned, for very difficult or painful periods, for very heavy bleeding, for situations like PCOS, endometriosis, or ovarian cysts. There are other options as a way to treat these. We would preferably like to balance your hormones naturally than to just give you a synthetic hormone, because we'll get better true healing that way. We want less side effects and for you to feel as good as you possibly can. If you have any more questions about the pill, please let us know in the comments below, and be sure to like this video and subscribe to our channel. If you click the bell notification, you'll get notified every time we have a new video out. Looking forward to seeing you next week.